Hello, everybody. Welcome along to a webinar. And today we're talking about Copilot. If you've been given Copilot in your Microsoft Teams or given access to M365 Copilot, you're in luck because in this video, I'm going to be talking you through some use cases for recruiting and HR, particularly in the healthcare space. The reason I'm doing this webinar is because I've spoken to a lot of clients in the past couple of weeks and asked them, how are you using Copilot? We're all seeing in the news Anthropic, OpenAI coming out with their Claude and ChatGPT models, and there's kind of a perception that Microsoft Copilot is behind. On the flip side, however, it's the only AI that a lot of healthcare organizations can use because of security and its integration into the existing IT ecosystem of the Microsoft suite of products. So in this video, I want to deliver a little bit of value and help to those that are being given access to Copilot but aren't particularly sure how to get the most out of it. I want to show you what's possible, what isn't possible, and walk you through a demo of some of the features that caught my eye. Just be aware that I'm not selling Microsoft here, and Copilot isn't perfect, and there's a chance that while I'm doing a live demo, it might slip up. So just bear with me, but I think that's a good thing because this is a new thing for everyone, and it's important to see how one can respond to glitches and hallucinations even. Because here's the thing, if you're rolling Copilot out across a healthcare organization, you're going to have potentially hundreds of employees that need to use and access this, and they have to access it to the same capability if it's going to impact the whole team. We don't just want individuals, optimizing their own productivity, which is great, but we want to raise the whole capacity of the organization. So if you don't know who I am, hi, I'm Adam. 7 years ago in 2019, I founded my first company straight out of college. It was called ApplyChat and still is actually. And we began making chatbots and trying to introduce chat interfaces into healthcare recruiting clients. Our first client was Humber River Hospital, now called Humber Hennick Hospital in Toronto. And we used Facebook Messenger ads, a Facebook Messenger chatbot to hire 3 ICU nurses in a couple of months during the peak of the pandemic. From there, we really doubled down on our nurse recruitment processes, all the while continually integrating and using chatbots in our recruiting process. So I'm sort of coming at this from the angle of a practitioner who knows you as the recruiting practitioner working internally in talent acquisition, and not as the tech consultant who just wants to throw an AI piece at you and expect you to know how to use it. I'm talking to you on your level and using the use cases that you'll probably be familiar with. So where are we in 2026 when it comes to the healthcare recruiting market? It's been a wild few years, particularly since the pandemic. And, well, change is continual, it seems. If you look across the market, there have been layoffs in recruiting functions, particularly as healthcare systems look to cut costs and improve their margins. So you can see here, Providence, 450 staff in Washington and Oregon. Oak Street Health, 219 jobs. Hospital operations are beginning of depressed margin and increased labor spend. So a lot of employers are trying to cut out their nurses. They're not really cutting out doctors, but they're cutting out nurses, which take up a lot of payroll, and looking at ways of increasing efficiencies. And we as recruiters are often the first to feel the brunt of those hiring freezes. If you're not hiring, employers think that you don't need recruiters. Mass layoffs are accelerating. There's a few more here. It's up in Toronto as well, in Ontario, this is happening. Tower Health in Pennsylvania announced 350 layoffs recently. Optum Care in New Jersey cut 572 jobs through the year, and they're closing 90 clinics by the end of November. So in healthcare, and particularly healthcare recruitment, we're in a bit of a bear market. One client I spoke to, a hospital in Washington State, told me that from a peak of 7 recruiters in 2024, she's now down to 4. and there's been a 50% reduction in the sign-on bonuses her employer are paying. On the other side of this, we have the rollout of AI, which has really accelerated since ChatGPT came to prominence in 2023. According to Gartner, 75% of companies are going to use AI in recruitment by 2027. And you're probably hearing your leadership executives questioning, how can we utilize these new technologies, particularly ChatGPT, Anthropic, Copilot, which is coming out to reduce our costs, make ourselves more collaborative, and make our teams more efficient. According to an AMN survey earlier in the year, AI roles are moving to the top of leadership priorities, and also leaders are citing the need for developing a clear AI strategy, 63%, and engaging clinicians and staff to grow adoption, 48%. So why are you here? Well, job security. If you want to survive in this new AI era of healthcare recruitment, I think you need to understand how to use these tools, and you can't be a stick in the mud that isn't going to adopt the new technology, because the non-adopters, I think, will be left behind. There's that oft-used quote that AI won't replace your job, but someone using AI will. I think potentially AI could be replacing a lot of recruiting jobs, and that makes it more important for you as the human in the loop, so to speak, to know how to use AI and then be able to present your skills and capabilities as that crucial element which takes what automation has done and then adds the human touch to make it actually work and make it of benefit to the candidate and to the hiring organization. There's also a big pressure to show improvement in KPIs and improve the balance sheet from AI adoption. So if you're at the leadership level, if you're a director of talent acquisition or a CHRO, you're going to care about how you can prove to management that you're integrating AI to make more hires and improve retention. So on this webinar, I'm going to show you Microsoft Copilot, how it can move beyond task-based AI and focus on the actual healthcare recruiting impact, which is relevant to healthcare providers. Microsoft Copilot, what is it? Well, I like to think of it as this way. So in your environment as a recruiter, you probably have three common spaces you're moving between. The first is your workforce. So that's often the Microsoft suite of tools. We have Outlook to send your emails, Word to write your stuff, Teams to send your messages, PowerPoint to make your presentations. You know, this has been about since forever, probably since I was born. And it's so ingrained into every healthcare organization's process and IT systems that when it comes to using AI, most that I've spoken to are locked down into using Copilot because it's provided by Microsoft and it integrates their products, and there's a shared enterprise agreement with Microsoft that guarantees data security that you just can't simply get with other providers. You also are moving within your ATS or your HRIS more broadly, where you're managing candidates, current requisitions, communications, and these are integrating their own AI too. So Workday, for example, they have their own chatbot where you can search through your database, you can create actions, which are really similar actually to what Microsoft Copilot can do with Microsoft 365. And finally, we have sourcing. So how do you actually get candidates into your pipeline? Well, they come from a variety of channels. We have social media, LinkedIn here, website, YouTube, and the big one, Indeed. Where Copilot sits is in the middle of these three in order to orchestrate and act as the glue for you to be able to move between those systems without ever having to leave Microsoft Copilot or Microsoft Teams. So it's really kind of revolutionary in the sense where what they're aiming to do is break down those barriers where maybe you'd have 5 tabs open, you'd have Indeed, Workday, Word, Excel, and create one chat interface to rule them all, which is connected out to these through which you, as a recruiter or recruiting leader, can type in prompts, send it out, and ask it to take action. So write an email to such and such, or find me candidates on Workday who were left uncommunicated with, who dropped off, who slipped through the cracks. Write them an email, send me the drafts, I'll send it out. So you can see some of the interesting use cases for this. And that's really, I think, where Copilot can stand out for you, and people aren't using it to that extent. Through plugins, connectors, custom agents, it can reach outside the Microsoft ecosystem and pull in data from those other parties. So it's like an AI layer. While it can do the tasks that we're familiar with in terms of write me a LinkedIn post or write me an email, and then you go into your email and you send it, it's not just tied to one AI model, which is interesting too. So it can use OpenAI's models because Microsoft is an investor in OpenAI. It can use Anthropic's Claude models, which you might have heard of too. The power isn't only in the platform and the large language model, we call it, which it uses, but in your data, through which, in a compliant way, Copilot can connect your different systems which previously have been siloed. It's not so much a case of integration, but communication, acting as a communicated device that can go into the ATS, find candidates, go into the email, and send those candidates email all at the click of a button for you. There's three kind of levels to think about when it comes to implementing AI in your healthcare recruiting function, particularly Copilot. So you have individual, functional, and organizational value. So if we go at the bottom here for individual value, that looks like AI helping one person to do their job better. So using Copilot to draft emails, summarize meeting notes, generate documents, the productivity is of a boost to that individual. This is where most teams start and where they stop. And it's a great first step because obviously, if every individual in your team is more productive, the team's productivity will rise as well. The good thing about this level of value is it's mostly achievable under the free Copilot plan. So when I say free Copilot, I mean that which is included with your Microsoft 365 subscription. So your organization is paying Microsoft, I don't know, $10 a month to get your email, Excel, and the rest of it. And Copilot is included for most of you within that. Now, some of the risks or the disadvantages of just staying at this level as an organization is governance sketchiness. So there can be a lack of clarity on goals, why you're using it, for example. What workflows are it being used for? Often unclear if individuals are handling those. It's also a little bit siloed. So without training and monitoring from a managerial level, people are going to be at varying degrees of literacy and capability. So you'll have your power users who are getting the most out of it, but you'll often have the stragglers who are still stuck in the mode of recruiting of 2021, which could be of detriment to the team because you've got people moving at different speeds. Another issue is overproduction, where now people can generate anything. They just create 20-page long documents and share those about, which we don't want. If you come on to the second level, that's moving up onto a functional use case. So I like to see this as a team identifying an area of their work that they want to make more efficient, collaborative, and ultimately effective through Copilot. That could be your sourcing function. So bringing together everyone who works on sourcing to look at the workflows that you have and then figure out how can we integrate Copilot in those workflows to make things more automated and easier for us. And I'm going to be showing you a couple of those examples today. And then finally, this is what the C-suite really want, which is organizational value. How are you bringing in autonomous agents and Copilot, and I'll explain a little bit more about that later, to really drive benefits to the bottom line, really make more hires, improve retention, and could be cutting agency spend, for example, to create great impact, maybe sourcing roles that have been open for 90 days, and you're using Copilot to create the best strategy to fill it. So it's time to jump into the magic of Copilot. There's wee Dobby. I'm a big fan of the Harry Potter series, and I think it's a good analogy to draw that some of this is a little bit like magic. So I'm going to open up my Copilot in a moment and talk you through my first two use cases that I think you benefit from. Introducing Hermione, the sorcerer, or sorcerer, whichever you prefer. Hermione's job is to go out and find candidates that we can't reach through our standard job ad process. Now, I've actually picked out a role for you to peruse, because I think it's important to tie the task you're getting AI to do back to role descriptions that have been created to add value to an organization. So this is on the NACR website, job board, Indiana University or Health for advertising for a consultant talent sourcing agent. So as a talent sourcing consultant, you'll focus on sourcing, attracting, engaging top talent, research, develop, and implement tailored recruitment strategies, stay on top of current recruitment trends and best practices. So when it comes to research, comes to staying on top of trends, that's one of the areas that Copilot can really input into. So you can log on to your Copilot via this link, m365.cloud.microsoft/chat, or you can also access it in Microsoft Teams. You can see here, there's a tab for Copilot in Teams as well. Now, thinking about that job description when it comes to the research, on the left-hand side here, you can see agents. So agents are pre-programmed AI agents that have been given a prompt and given instructions with a timeline to fulfill those instructions. So for example, I have created this agent to provide our sourcer market insights on the Indianapolis or Indiana State recruiting market. So I've configured this within Copilot. I didn't need to program it. I just made it in there within agents. And the most important part of this is in the instructions. So I've told it produce monthly recruiting intelligence brief, general guidelines, and given it some skills. I haven't put any knowledge in terms of my organizational information in here. I'm just getting it to use the web. And I've installed it so that whenever I request information, it gives me it back. It's not doing it on a schedule or anything like that. Now, I'm going to show you one more thing before I hit this agent with the request. This is a prompt library. So I've used this to manage what I'm going to ask of it for this webinar. But you can see here that this could turn out really useful for teams. If you want to standardize things across your function, you really ought to have a Copilot prompt library and specific guidelines on how to use it and which prompts to input and in what context. So here, for example, I have one to help me write a prompt. I have one to verify that that prompt is quality, and then one to double check the output of the Copilot after it is prompted. So jumping into the first one, because I have pre-programmed this agent, see here a new agent, I went in and created it. All I need to do is ask it to give this week's brief, and it's going to start getting to work for me. Now, this can be programmed so that it sends a message at 9 a.m. on a Monday, for example. But you can also just have it go on request. So you can see here what it's doing is pulling context information from IU Health's website and from local media outlets, so Indianapolis Business Journal. And it's tracking signals that the sourcer can use in their outreach and conversations with candidates. So you can see here that it's highlighting a public information event in West Lafayette Hospital, that they're constructing a hospital downtown to be opened in late 2027. And one of their hospitals received a tree campus designation on environmental qualities. So if I scroll down a little bit, you can see that it's created 6 talking points for the recruiter to use this week. So in an era of instability within healthcare systems, it's flagged how IU Health is showing discipline and long-term sustainability. And it's linking to the articles and suggested use cases for each line. So if it's an early career clinician, you can say, is environment important for you? We have this proof on the recognition that we've received. And I can actually have a conversation of this as well if I want to ask it, you know, to nail down a particular messaging or talk to about a candidate I'm speaking to and ask them, say their environmental sustainability is very important for this candidate. What can you suggest for me? More around that. So we come into this. This is quite simple. This is call and response. And if you don't have access to agents in here because of security limitations, then you can just message Copilot a similar prompt like this, where give me a weekly brief using local news outlets on our system for items that our recruiters can talk about when doing sourcing calls, or our sourcers can talk about. I'm going to move on then to a real kind of piece of magic that I think is showing the capability of this. And do bear in mind that this is just really being rolled out. And it's called Co-work. So you can see here, it's got brackets, which is Frontier, because I've signed up to get access to their more experimental features. And it's unlikely that your organization will have this enabled, because a lot of healthcare providers are keeping things kind of locked down and limited to start off with. But this is the direction that they're going in. And Copilot Co-work has the capability to go into your calendar, go into your Outlook, go into your Excel documents, and edit the content, create new content, download it, give it to you, put it on OneDrive, and really fulfill that promise, which I shared earlier, of this acting as an orchestration layer going between different siloed systems. So here's my challenge right now. I've been given a OR nurse job that has been a challenge for us. We at IU Health have these jobs open constantly because we can never fill the department. And I'm going to see how I can use AI to go into my ATS and find out who in that ATS has applied for OR jobs in the past and we haven't gotten back to them, or it wasn't a good fit at the time. And then feed that back to me and create custom messages in my email, creating drafts in my actual inbox, which I can then just go in, tick a box, and say, I want to send this out. So I'm going to jump over to Copilot and ask it to help me with the prompt. Okay. So I know roughly what I want to do, but often it's hard to know exactly what to say to get the most out of it. The good thing is you don't need to know that really. You can ask it to give you the prompt. So give me a prompt to achieve this outcome. I want to identify low-hanging fruit in the ATS and email inbox and write messaging to them, creating email drafts in my Outlook, ready for me to send. So it's going to go take that idea and it's created the prompt. So the custom prompt has been made. And what I'm going to do is take this into Cowork and put the prompt in. Now, across their systems, doesn't have to be in this agent, you can add work content, which I think makes Copilot really stand out from the pack, because if all your data and information is in SharePoint, it's in Word, it's in Excel, if you're using ChatGPT and it's outside that, you're not going to get much done. You really need something that's intelligently able to move across all your information and create its own kind of model of understanding based on your reality. So we'll jump over to Cowork here, and I'm going to feed it access to some of my content. Now, I haven't connected this to my actual ATS just for privacy for the people in there, but I have kind of spoofed up an example of what a lot of ATS information would look like. So here we've got a database of 50 candidates. These are all fake generated pieces of information, generated by Copilot actually. And you can see here just the common fields of education, qualification, certification, license, state, their expectation of salary, shift preference, when they can start, status, date applied, recruiter notes. So imagine this is my ATS. I've connected it to the prompt. What's the prompt going to do? Identify the low-hanging fruit candidates in the ATS and my Outlook, enrich and assess why they're a strong fit, write the personalized messaging, and create the Outlook drafts. So I'm going to click send and put that to work. Now, the question is, what do you do while these things are working away? You can see that it's still doing it, and it might take a minute. So I'm going to briefly tell you a little bit about access and how this matters to you. So Copilot is at an advantage really because IT departments have a business agreement with Microsoft when it comes to security, and integrating Copilot is just another layer of that. There's questions around AI governance and security, which I know a lot of directors of IT and cybersecurity are asking of Microsoft, but it's a lot of a smoother implementation integration than if it's an entirely new startup company that just started last month and you're suddenly going to be handing them over a connection to all your business information. That's not good. People don't want to do that, particularly in a HIPAA environment. So it's important for you in healthcare, HR, or recruitment to know how to partner with IT, because they really hold the key to the castles for how much of Copilot's potential you can avail of. So jumping in here, you can see this is a Microsoft 365 admin center that your director of IT could come in and they can click here, allowed agent types, and they can just disallow all agents for you. And then you'd have much more limited access. If that's the case, if you're using Copilot and your access looks a lot shorter than my own, don't worry. We could do this more manually, in the sense of Copilot's not really moving between the systems itself and writing those emails within my Outlook. All we need to do is work with CSVs or Excel files. So I would be downloading my candidate database here from the ATS, and then I'd be uploading it as such. Yep. And then I put the prompt in here, but the prompt would look different. It would say, return this to me with a new column with a message that's customed for the individual that I can then copy and paste into my own Outlook. So it's still certainly possible to do what I'm showing you on the free tier of Copilot, but you just need to be more in the loop on the sense of you're copying and pasting information over between areas. Another area that you can do while things are in progress here is you can make more requests. So you can have it working on multiple things at the same time rather than kind of just sitting staring at your screen waiting for it to complete a task. Going to show you one more while that's working on it, which is researcher. And you can see that this looks a little bit different than the custom one I made because Microsoft are putting a bit of effort into building this out. It can do quite deep research on particular areas of, see your partnership opportunities, customer feedback, project status report, or summarizing information. And I'm going to show you one that it did for me, which was a bit of a, if it loads, a bit of overkill, but I think it's helpful to show the potential of this. So I asked it to, using my candidate's information, prepare a brief for the interview to share with a hiring manager. You can see it did 87 steps and created this whole big tome of information on the candidate and the current recruiting market. I asked it to condense it in, and you can see that it did that too. I just asked it there to create a PDF of the original one, and you can see that it's done that in my files. So to open this up, see here, researcher's gone a bit overkill, giving me 8 pages, but a lot of this is helpful in the sense where it's given the candidate's experience. This is just taken from what's in the ATS. I said, look at the ATS, create a brief for this candidate for their interview. All the notes in this were updated from the sourcer's call. Let's see if I can zoom in on it for you. And you can see that it's brought the whole market context. So 8 pages is a bit much, but this could be really useful if you're a smaller team and you need more help preparing for these types of things. I noted that he was a travel RN, so it's came up with potential objections he might present and how to position. So this, as a really handy guide, I think very helpful. And you can just do all that within this researcher section if you have access to it. If you don't, again, this can be prompted with just the normal new chat, and you can use this to help you create a prompt. You could say, help me create a research brief. I want you to make the prompt for it, and it's for this interview with this candidate. So you can see here what Copilot has executed on my behalf while I was showing you that. So if we look at here, let's go into this. It's created 11 drafts in my Outlook folder with internal notes at the top of each, explaining the rationale of each planned outreach. So these are all candidates that were in my ATS, and it's identified who would be a strong prospect to reach out to, who would be a kind of mid-level prospect, and coded notable gaps. So if I open up my Outlook, I should be able to see the drafts of those emails that's created in there and really demonstrate how it's co-piloting. I've given it a task, it's went away, it's done a lot of the work on those custom messages, which often take up a lot of time. And it's done something in a couple of minutes that would take me maybe half an hour. So because this is a draft, it's added this internal note, suggested follow-ups. It's plugged the email into the field, which is helpful. And then it's given suggested messaging. So between those three channels, if you think back, the spoof ATS I created, the Copilot, which is acting as the go-between, and then Outlook, it has identified candidates that meet the needs in my ATS, written draft messaging to them, and then set up those emails whereby I just need to click send on them all, or I can adjust them if I want. Now, these emails are a little bit drab because of the prompt that I included, and you can customize that prompt as well. So you can say like make the email outreach personable, or refer to notes about their personal life that we took in our previous conversations, rather than making it all about us and the work. So this content can be altered depending on what prompt you put in. So I'm going to introduce you to someone new moving through the process, and that is Ron. So Ron is the recruiter, okay? The recruiter is going to take the candidates that the sourcer or sorcerer has came up with, and then get this hiring manager interview scheduled, and really move that candidate through to the next step. So some tasks that he would need to do is writing up a slate of the hiring manager of the shortlisted candidates, and then doing interview preparation. So we've done the interview preparation piece. I showed you that while my other task was loading. And now let's jump into writing up that slate. So what does that look like? Well, I'm going to tell it that I've identified a handful of candidates that have responded to my emails. I like them. I want to set up a hiring manager interview with them, and they've all said yes. So I need to prepare this hiring manager to do the interviews. And over my work, we've worked with like 175 clients, doing mostly nurse recruitment. A major blockage in recruiting is communication with hiring managers. How do we get them to give availability for interviews? How do we get them to move candidates through, all the while they're doing their important clinical patient-facing jobs? Big challenge. Well, using Copilot and AI in general can help customize whatever you send to that hiring manager to be just at their taste, I suppose, and aptly informed by your experience with them as an individual. So you're going to want to really understand what makes that hiring manager tick, what have they rejected people for in the past that maybe you disagreed with, and how can you pitch candidates in the best possible way to convince them to really take action on them. So I'm going to ask Copilot here to write up a candidate slate, just a very simple task and document here of the 4 shortlisted candidates. I'm going to connect it to my database. And again, you can just give it a downloaded Excel if you don't have this kind of access to your work files, or your ATS. Now, while it's doing that, I'll show you some integration. So Workday, for example, you can add in as its own agent here. And then you see at the top, if you're on Workday, then you can talk to your ATS through Copilot here. So you can do the tasks which I've been showing you, not entirely sure the functionality, but you can do similar tasks that speak to your ATS and bring it into Copilot and then bring it over to your email as well. So let's go over to our chat. Sometimes if you give it a prompt and then you like bounce off. It doesn't save it. So I'm going to need to do this one again. It might have saved if I refresh, but I'm not going to do that. And again, this is going to be a content creation task. So it's going to make a new Excel doc for me. See here, it's doing coding in the background. So I'm going to give it a minute while it does that and jump back over to talk about how much all this costs to get these features from Microsoft. Because I was kind of in two minds to show you either what most people have access to or what's the optimal, well, no, what's the maximum potential of this tool. And I went for the maximum potential. It's probably got a lot more potential just starting out, really, for what I'm showing you. But it's likely that a lot of organizations are still at this stage of licensure where they're not paying the add-on license to get the custom features like co-work, which I showed you. So how does it work? Well, this is included, as I said, within the standard M365 description. And essentially, you can work within this new chat section and the agents that your organization has given you access to. Where it's limited is on the integration into your, it's called Microsoft Graph, which is their suite of Excel, Outlook, etc., to go in and take actions within them. So it can't go in and write an email for you, for example, under this licensure. The good thing is you can actually use the agents, which I've showed you, so you can get access to some of the more advanced features. If your organization does a pay-as-you-go style billing setup. So each user of Copilot is going to really incur fees for each message they send. Say it's like 1 cent per message. Then at the end of the month, the organization just pays its overall bill for team, and things can be limited in terms of rate and spend, and it is quite customizable that way. If you're looking at the paid license, so I'm paying $30 a month. I think it's cheaper if you do it for a year. And if you think about it, if it can save 1 hour of time a day or 1 hour a month, 1 hour is worth $30 at least. So I think particularly for recruiting in HR teams, even getting 6 or 7 licenses of this the premium level of Copilot can be quite impactful, taking into account the opportunity that there is to change how work is done. Having said that, I think a lot of organizations think, oh well, we have 1,000 employees, we couldn't possibly spend an extra 30,000 a month, and that makes a lot of sense. You don't need everyone in the team to have this Copilot full $30 a month license where it goes into work data and creates content, particularly if they're not at their desk all day. You can have the normal license, put them on pay as you go, and even with the normal license, the standard license, you can achieve a lot. So let's jump over to my candidate slate. You can see that it's prepared it. In terms of what's in the slate, it's given me a summary, and it's given me an Excel. So over here in the Excel, let's zoom out a little bit. You can see that it's put in the candidates, it's put in their ATS info, taken aptitudes and strengths from the call which the sourcer has had or the previous recruiting call, positive notes based on that call as well. That call can have notes taken through AI. Like if you do it on Microsoft Teams, it can record the notes and then post them over into your ATS automatically. Let me know if you want help setting that up. interview book, recommend the next step. So it's been a big help there, where it's gone in and just created that whole state for me, which I can then fire on to the hiring manager after making my additions and changes and recommendations. Speaking of which, we're on to our final character, which is the hiring manager himself. So where do they come into this? And through considering how the hiring manager works in this, we're really moving up to that organization-based value, where our sorcerer has done better in their terms of their outreach. They've been able to engage candidates they'd forgotten about in the ATS. They've been able to write emails very quickly, send them out, bring in the function, the recruiter, to help them with setting up this hiring manager interview. And now we're reaching out across the org into a clinical department. So it's no longer just in recruiting, it's saving this hiring manager time too. Let's say that they've done the interviews and they've picked their favorite candidate. How do we do offer management? How do we check for pay equity? How do we flag risks? Well, bearing in mind that if security is okay with it and everything's everything's tooled in the right way, the hiring manager will be able to connect their Copilot to your pay figures and internal salary files, like listing who gets paid what within Excel or SharePoint. It can compare compensation across departments, and then it can go out into the web and compare compensation, benchmark it against what competitors in the market are paying. So I'm going to go back on the Copilot. I've got my prompt library here. So let's say that your organization has one of these. For everyone, there's a prompt library or the function. So here's my prompt. I'm going to customize this depending on the candidate that we're going to offer the role to. So jumping back onto the sheet of candidates that it just made for me, I'm gonna need to, I think I downloaded that, so I'll need to pull that up on downloads. Just a second. Here we go. So you can see here we have salary listed. So Brandon wants 97,300. Melissa Rodriguez wants 87,100, which is a gap of 10 grand. So I'm going to go and ask it, help me verify like pay equity and offer management between Brandon and Melissa. So I like the look of Brandon, but pay is a little bit high. I want to compare that to see if that's fair. If we could offer Brandon to match his salary, would that work in terms of fairness across the organization compared to our current staff members? So plug this in, just downloaded that file. We're thinking of offering Brandon 97K a year. Also considering Melissa. Help me make a prompt for this. I'll share my screen. So here I'm getting help to make a prompt. And you can also work it so that whenever someone asks it to make a prompt, Copilot saves that in the prompt sheet. So it's adding to the base information that the organization has. So I think the feedback loop is an important thing to consider if you're trying to go for that functional or organizational value as well. That things can't just exist in isolation or in silos anymore. That you can use this to really connect things and make them more efficient. So I'm going to ask us to use sample data if necessary. I did have a sheet of pay, but it's gone. So I'll just go into my prompt and see what this can come up with. So clicking new chat and putting in the prompt here. So this is from the hiring manager. We're considering compensation offer. Here's the offer. Use sample or proxy data if internal data is incomplete. Label assumptions, internal equity check, identify risks, etc., etc. So considering like this again would have access to your HRIS system. It knows what people are being paid, and it gets to work on figuring out if this offer is reasonable. So give me a quick one there. Generally defensible pay on market pay, market typical. It's giving me advice on what we do if we go with Melissa. And then it's looking at inferred internal base structure across the market. So I've done this without access to clear kind of database of pay within my organization. And in the absence of that, it's been able to go out into the market. So that's another use case without having those premium subscriptions that can reach into your files, or if you don't have security access to them. Now, again, over creation of content is often the thing. Like, there's so much. You can ask it to, summarize this. So summarize this in 1/4 of the space. I mean, yeah, don't have all day to be reading that. Brandon King, primary risk, internal equity, risk, market snapshot, recommendations. So there you have it. Across the 3 different role types, we've stretched through the recruiting function, across into the clinical side of the hiring manager, and each has used Copilot in a step along the way. So I'm going to go on to close off here and talk about key takeaways. What can we learn from this presentation, and how can you use Copilot? So the most important thing, in my opinion, is taking the functionality of Copilot, looking at what your team do day in, day out, and identifying where can Copilot's capabilities add to the efficiency, collaboration, and really impact those key metrics of numbers of staff recruited, number of staff retained, and cost per hire, time to fill. All the key metrics that you've been working on historically. It's not about bringing in a new technology just because. It has to have an impact on the bottom line. Preferably, you do this as a team, and it's not just individuals are left to fend for themselves when it comes to accessing and using this technology, because there's going to be varying, conflicting levels of ability and adoption in your team, which will create skewed outcomes. It's better to invest in training and invest in support so that everyone knows how to use it, and you're monitoring how they use it. There's certainly ways you can set up where through those agents I showed you, you can track their usage. You can track their usage by user. And then you can coach and help people that are finding it difficult to adapt to use this. Another key takeaway is Copilot isn't just another chatbot. It's not just a place to ask questions or generate text. As I've shown you, it can move between all the layers of your HR infrastructure when it comes to Teams, when it comes to Excel, Outlook, into your ATS, and it can even go out onto the web. And we're looking at building a process where we can actually do sourcing through it, through a few kind of middleware APIs where it goes out, we give it a brief in Copilot, say find me XYZ type stuff, it goes out, finds them, and then it returns them into the chat. It's really going to become that one interface that can dominate the day of a recruiter or sourcer to get much more work done. So if you are curious about implementing Copilot in your organization, we're here to help. So as I mentioned at the start, we're not an AI vendor here at ApplyChat. We're practitioners. So we've been working with recruitment teams in healthcare since 2019. We've helped our clients source and hire 15,000, mostly nurses, but also doctors, PTs, CNAs. And we're using our background and experience in AI and automation gained over the last 6 or 7 years since launching ApplyChat to train and help our clients adopt, use, and get value out of Copilot. So you can visit applychat.com/AI if you want to learn more. At the moment, because it's a new service line, we're doing it completely for free. So we're doing a free 1-hour consultation and then a process work map, which looks at all your workflows, considers what can be automated, what can be improved, and where can AI orchestrate efficiencies across the board that help your recruiters, your HR staff, your sourcers, labor relations people even go in and be a lot more productive, efficient, collaborative, and achieve what really a team of twice the size could do. So we can come in and help you with that, train your team, and once we know what needs to be done, go out and even create custom agents like those I've showed you earlier today. So do visit applychat.com/AI if you're scratching your head thinking, okay, this looks great, but how do we implement it into our business and function? We'd be happy to help you. If you enjoyed this webinar, please do comment as well or send me a message. I'd love to hear from you and see how your organization is implementing and getting results from Copilot. So thank you so much for joining me, and I'll see you on the next webinar.